بسم الله الرحمن الرحيم. أنا معكم دكتور عمر البطوش من الجامعة الأردنية. Today I will talk about an interesting case in musculoskeletal imaging. It's very important for also as well for general radiology. So we will have a look. As you can see here, this is a 20-year-old patient presented with fracture of left-sided femur distally. As you can see, and this is frontal view. So this is a comminuted fracture, mainly here the fragmentation involving the lateral cortex, as you can see. Another view as well, this is lateral view. As you can see here, the sharp edges of the fragmented bones. Please have a look carefully. And this is another frontal view for the same patient at the time of fracture. So here, as expected, so for this fracture there was a fixation. This is lateral sided plate with screws. The alignment is preserved for the plate. It's unremarkable, as well as the screws are in a proper position. There is no major extraosseous component, at least here in the frontal view. No breakage and no dislocation as well. So the alignment is intact. Here as well, this is the frontal view. As you can see, the screws are in phase, but the alignment of the osseous cortex is preserved as well. So this is the post-operative images. As you can see here, we have calcification. These are foci of calcification, and if you have a look at the dorsal aspect, you can see that there is soft tissue swelling with mass. So we have displaced, this is the fatty plane, the fatty plane as well are displaced dorsally, so there is a mass at the dorsal aspect of the site of the fracture. So the patient is still complained. Bone scan was done and showed uptake, it's intense uptake regarding the left distal femur. And follow-up scan showed that there is a heavily calcified mass depicted at the site of the fracture, multi-lobulated appearance, and progressed in size compared to the previous study. So, as you can expect, this case is a malignant process on top of the fractured bones. So we need to carefully have a look at the pre-operative scans to see if there was a mass at the fracture. So we will return back to the pre-operative study. As you can see here, we have, this is a sharp edges of the fracture, but here, as you can see, we have subtle sclerosis at the site of the fracture. This is one view. And this is another view. As you can see here, we have soft tissue swelling and we have sclerosis. We have sclerosis also as well at this region. I don't know if this is very apparent on this image, but maybe the most important image is this one. So as you can see here, if I want to draw the boundaries, so I will try. So from this side we have a partially defined border of a soft tissue mass at this site of the fracture. So in fact, this was a pathological fracture. You need to worry a lot when you describe fracture. You need to think always about if there is any underlying lytic mass or osteoblastic mass, but you don't need only to mention the fracture or to describe if where it reaches. For example, if it has an intra-articular extension, or also if it's comminuted, non-comminuted, displaced, non-displaced, complete, partial fracture. So the most important thing is to say that this is if there is any underlying process. So if it's pathological fracture versus traumatic or benign fracture with no underlying cause. This is very important. So it's also from medical legal point of view, this is very important to mention that clearly, because if you mention that there is, so it's simple fracture, so there will be fixation, and if there is a fixation, so all of the surgical bed and all of the margin of the tumor will be disrupted during surgery, so the patient will end up with a new situation. It can be, for example, the amputation is the only solution for this patient. So it's very important to differentiate between pathological fracture and non-pathological fracture. So here I also put further cases regarding examples of pathological fracture. As you can see here, this is the left side humerus, it's frontal view. So we have here fracture line at the lateral cortex, but as you can see, the medial cortex is eroded, and we have a lytic process at the head and neck of the left humerus. So it's very important to describe it as this is a pathological fracture with no doubt. Another example, so we have non-displaced fracture. Non-displaced fracture most apparent at the cortical defect at the lateral aspect or at the lateral cortex of the right humeral shaft. But please don't forget to say clearly that we have here an osteolytic process and we have permeative changes. So this is permeative changes at the proximal shaft. So this is indicative of pathological fracture. If you suspect such an appearance, it's really important if you are not sure, so simply advise MRI scan to be done. Another example here, so this is it's more or less clear that we have a destructive process at the right humeral head, and also we have a cortical defect, so we need to describe it as pathological. Another example here, so here we have cortical defect, and here as well, so it's a fracture clearly, but we have also as well expansion and relatively decrease in the osseous or intramedullary density, so I'm suspecting an underlying process. So this is another view. It's more clearly, for example, I can see here that we have expansile lesion. It's extending from this level to this level. So we have osteolytic lesion complicated by fracture. It's very important to say that there is pathological fracture. Another example here, so we have a cortical defect medially as well as laterally at the right humerus, and also as well we have underlying lytic process at the proximal humeral shaft. In this case, for example, also we have here, please also in any plain radiography reporting session or reporting film, you need to have a look also at all regions. So here, as you can see, we have lung mass, right-sided lung mass with this fracture, so it can be due to metastatic process complicated by fracture, and this patient was first presentation the fracture. Another example here, so we have permeative changes. It's also in fact there is no explanation for permeative changes in acute presentation. In acute presentation, we don't have, for example, the disuse osteopenic changes of the skeleton. So we have here permeative changes. We need to mention that we are suspecting underlying pathological or underlying mass that was complicated by pathological fracture. As you can see here as well, we have a cortical destructive changes. So the cortex is not sharp as well. Another example, so here this is a left-sided humerus. As you can see, we have transverse fracture line at the left proximal humeral shaft, And also as well, we have destructive process. It's subtle here in this case, destructive process. So maybe we can advise, for example, another view. In fact, I only have this view for this patient, but if you are in doubt, you can take proper view, another view, and also as well to advise MRI scan. But here in this patient, I can see a destructive process along the fracture line. Thank you for your attention.